One of the procedures that I do is called a nasal specific, which is a technique we use to balance the bones of the skull. Now, medically, they claim that the bones of the skull fuse after about the age of 21, but the reality is the bones of the skull move every time we breathe. The skull is filled with what we call sutural lines, or little cracks within the skull, and they're there for a purpose. They're there to allow for the cranial bones to move. And when a person has a concussion, the cranial bones, the sutures, become overlapped or jammed. And that affects the way the cranium works with the brain and the central nervous system. So years ago, Dr. Stober developed a technique that allowed for correcting that. And we insert a small balloon about the size of the little finger into the nasal passage and inflate it and release. And we do that 4 times on either side. And what that allows us to do is to go inside the cranium and expand it so that the sutures that are jammed or locked unlock and begin to move again. And it's probably the single most miraculous technique that we use in our clinic because of the changes that occur. Changes in deviated septums, breathing problems, people who snore, kids with learning problems, migraine headaches, but most importantly, chronic sinus problems clear up within 4 or 5 treatments. It's amazing. People can avoid surgery. We've avoided surgeries countless times with patients, and it's actually a life-changing process. And there's no side effects. There's no risk involved. Probably the most dramatic recent example of the value of the cranial work is Torah Bright. As most of you know, Torah Bright is the little gold medalist, women's half pipe. 8 weeks out from the Olympic Games, Torah sustained a major concussion. The trauma was so severe it knocked her helmet off. She hit her head and face on the edge of the pipe, which the pipe is ice. And I saw her 3 weeks later in my office. Torah was unable to do a one-legged squat without falling over. That's how bad her equilibrium was. When I heard that she had sustained a concussion, my heart sank because I realized that, that what may be the kiss of death as far as her competing at the Olympic level. And she'd worked so hard for so long to get to that point. So I did my evaluation, found major cranial stress patterns, and we began to do the cranial work. And after a week of care, Torah could do a one-legged squat with her eyes closed, her equilibrium was back, and she was cleared by the neurologist to begin to train again. I worked on her up till the day of the Olympic event, and of course the rest is history. She won a gold medal. That competition requires impeccable balance and skill, and so it really demonstrates dramatically just how powerful the cranial work is in changing the dynamics of the cranial system, relationship with the brain and the neurological functioning. So the cranial work has so much value for so many conditions related to the sinuses in the head. And so if you have those types of problems or know anyone who does, it will be a godsend for them to experience the power behind the nasal specific.